If you're building a private practice, I want you to remember this. The patient experience does not begin in the exam room. Think about it. By the time you walk into the room, you introduce yourself as the physician, your patient has likely already formed an opinion about your new practice. They've looked you up online, they've driven to your office, they've walked through your front door, they've interacted with your staff. And all of these experiences are either building trust for that patient in your practice, or they're taking away from the trust that patient is going to have in your practice. If this is your first time catching me here on YouTube, I'm Dr. Brittney Anderson. I am a family medicine doc and private practice owner. And on this channel, I share practical advice to help physicians plan, open, and grow their own private practices. So today I want to give you 5 things that your patients see before they ever see you in the exam room. Number 1, I want you to think about what they find when they Google you. Before many patients ever call our office, they're going to Google us. So take some time and Google your own practice. What comes up? Is your address correct? Are the hours correct? Is there a link to your website? Are there good photos? Once you're up and running, do you have reviews, and are they positive reviews? Don't assume that patients are going to work hard to find you. Make sure it's easy for them to Google you. The second thing is your website. I want you to look at your website from the perspective of someone who knows absolutely nothing about your practice. Within a few seconds, can they figure out who you are, what you do, where you're located, and how they can become a patient? Your website does not have to be elaborate, but it does need to be clear. One of the mistakes I see physicians make when they're opening is they spend a lot of money trying to make their website super impressive when what patients really need is for it to be useful. So make sure your website's useful. The third thing is you're building an entrance. Now imagine your patient is coming to their very first appointment. Is it easy for them to find your building? Is there adequate parking? Is your signage clear? When they get to the door, do they know they're in the right place? Remember, you drive to your office every day. Of course, you know where you're going, but look at it through the eyes of someone who has never been there before. Is it easy for them to find your office? The fourth thing is your staff. Now, your staff can make an impression on patients absolutely before you ever do. How are they dressed? Do you require uniforms? Are they clean cut? Are they wearing name badges? Do they look professional and prepared? And beyond experience, what does the patient see happening around them? Are staff members smiling? Are they making eye contact? Are they acknowledging the patients when they're around them? And are they interacting professionally with each other? Your team is representing your practice from the moment that patient walks in the door. Speaking of patients walking in the door, the 5th thing that you need to think about is your waiting room. If you already have your practice, go sit in your waiting room. Sit down in one of the chairs and look around. Is it clean? Is it cluttered? Are the chairs comfortable? What's on the walls? What's sitting on the front desk when you look up? What do patients hear? What do they see? What do they smell? You don't need to spend a fortune creating a beautiful waiting room, but it should feel like someone thought about the experience of the person sitting there. And that's really the point of all 5 of these things. I want you to be intentional. You can provide incredible medical care, but your patients are experiencing your practice long before they ever walk into that exam room or before you ever walk into the exam room. And when you're building a private practice, you have the opportunity to design those experiences from the beginning. That's the beauty of building your own private practice. Now, if you want a couple more things that I know patients see before they ever see you, I actually covered 10 things patients see on my podcast, Physicians Hanging a Shingle, episode 69. So if you're building or planning a private practice, go listen to that full episode. And before you leave this video, here's a little bit of homework. If you're already in practice, I want you to Google yourself. If you're not in practice, I want you to start as if you could Google yourself and walk through the entire patient experience from the time they Google you until the time you walk into the office for their exam. And then ask yourself, what would I notice if this wasn't my practice? Or if you're just building your practice, ask yourself, what do I want my patients to notice when they come into my new practice? I'll see you in the next video.